Hello everyone. This week we're going to talk about antimicrobial treatments. Let's talk about antibiotics. What are antibiotics? Antibiotics are actually natural products produced by bacteria and fungi. Now, you might be wondering, why would bacteria or fungi produce antibiotics in the first place? Well, they do that so that they can inhibit the growth of those competing microbes that are sharing the same habitat with them. I mean, think about it. If they're all going to be, consuming the same nutrients, they're living in the same place, what's going to happen? The nutrients are going to start depleting. There isn't going to be enough space for all of them. So some bacteria and fungi out there, they start releasing these antibiotics out of them so that they can actually kill and inhibit the growth of those, microbes that are around them. And the greatest numbers of microbes that are derived from bacteria comes from those two genera, Streptomyces and Bacillus. And from, the antibiotics that are derived from the molds, or basically the fungi, are from the genre Penicillium, famous for producing the penicillin antibiotic, and Cephalosporium. These are some terms right here that you need to be familiar with. So prophylaxis, that's when you are using a drug to basically prevent the infection of someone that's at risk of getting infected. Antimicrobial chemotherapy, and I know when you guys hear chemotherapy, we usually think of, cancer drugs, but actually the word chemotherapy doesn't always have to be associated with cancer drugs. It could also be associated with, antibiotics as well. So antimicrobial chemotherapy, that's basically when you're using, certain drugs like antibiotics, for example, to control basically the infection. Antimicrobials, those antimicrobial drugs, again, basically it's going to be given to someone, to help them get over that infection that they have. And those antimicrobials, by the way, it's such an inclusive term, regardless of its origin. What does that mean? It means that some of these antimicrobials are going to be produced by bacteria or fungi, so they are natural. And then some of these antimicrobials, they are man-made. Okay, so they are basically kind of like we tweak them. Okay, we take the natural antimicrobial and kind of tweak it a bit so that it could, let's say, work better. So again, those antimicrobials could be either natural or synthetic. Antibiotics, as we said, those are, some of these natural products produced by, some bacteria and some fungi out there. And we usually, when we use the term antibiotics, right, that term is going to target bacteria and not any other microbe. So, and that's the difference between when you guys use the term antimicrobial versus antibiotic. So when you use the term antimicrobial, that drug could target so many different things. So if I say an antimicrobial, I could be talking about a drug that could target bacteria, or it's a drug that targets fungus, or it's a drug that targets protozoa. But when you use the term antibiotic, then you are referring to these drugs that are going to target bacteria and only bacteria. So if someone has a viral infection, you don't want to be prescribing them antibiotics. It's not going to work because antibiotics only work against bacteria. Now, semi-synthetic drugs, that's what I was kind of, explaining at the beginning, is when we take, certain drugs and we chemically modify them, okay? And we usually get them from natural resources. So you would get, that antibiotic, let's say, that's produced by a certain bacteria, and then you take it and you go ahead kind of, modify it a bit so that it would work, let's say, against more bacteria out there. So that's what we refer to as semi-synthetic drugs. Synthetic drugs, those are entirely made by the chemical reactions, and we don't isolate them from natural resources at all. Now, when you use the term narrow spectrum versus broad spectrum, narrow spectrum means that these antimicrobials that you are using are only used against a certain group of microbes. So, for example, we're going to take a look at how there are some antibiotics out there that are narrow spectrum. They only work, let's say, against gram-positives. There are certain antibiotics out there that only work against gram-negative bacteria. So those are narrow spectrum because they only target a certain group of bacteria, for example. Okay, a broad spectrum, those are antimicrobials that are actually going to work against a huge variety of microbes, for example, both gram-positives and gram-negative bacteria. And actually, sometimes what we do is sometimes we take a narrow spectrum antibiotic, okay? And again, if I use the term antibiotic, then we know it's only targeting bacteria, right? So there are some antibiotics out there that are narrow spectrum, so they only target either gram-positive or, as I said, gram-negative. But sometimes what they do is they take these antibiotics, they take them to the lab, they chemically modify them to turn it into a broad spectrum so that this antibiotic can work on a broader, range. Now, before you go ahead and prescribe an antimicrobial drug, we're going to talk about what are some things that you need to watch out for. But before we do that, let's take a look at, what's some ideal characteristics of an antimicrobial drug that you are about to use. Number one is you don't want that drug to be toxic to the host, right? So if you're going to go ahead and ingest that antimicrobial drug, you don't want that drug to actually affect the host, kind of like, let's say, for example, you in a negative way. You only want it to be toxic only to the microbe itself. And then it would be better, right, to have a drug that's microbicidal versus microstatic. Remember how we said when you see the suffix cidal, that means this drug is going to kill, versus if you see the term static, that means this drug is just going to inhibit, kind of like slow the growth. So it will definitely better to get a drug that's going to kill versus, inhibit the growth, because you want to get rid of that infection that you have. And then you want this drug to actually be soluble so that, when you ingest it, it's going to have an easy time, right, diluting in your body fluids so that it would have an easy time spreading, right, in your body. And then, of course, you want it to be potent enough so that it could last long enough, right, to go ahead and kind of do its job. You don't want it to break down or get excreted out of your body very fast before it goes ahead and finishes, the job. And then, of course, hopefully it's not going to lead to antimicrobial resistance, but with antimicrobial resistance, I mean, there are certain factors that contribute to that, especially if someone, let's say, is taking an antibiotic and they are not taking it properly, or they finish their antibiotic course before time, then that can cause antimicrobial resistance, and we're going to talk more about it. And then, of course, this drug, you want it to either complement, right, your immune system, or you want it to kind of like assist your immune system. So, so that, again, it would go ahead and kind of basically assist, right, your immune system so that you can get rid of that infection. And then, of course, you want it to be able to pass it through your tissues and your body fluids and remain active, okay? And you want it to be able to get to the site of infection, okay? So it has to have the ability to kind of pass, as I said, through membranes, etc. And I mean, for consumers, it would be best, if it's not too pricey, of course, not too expensive. And then another thing is, you don't want it to cause allergies. And of course, that's going to depend on each individual out there, what type of allergies do they have. And so again, that's kind of something you definitely have to watch out for before you prescribe someone certain, antimicrobial drugs. You want to make sure that they are not allergic to it. So, and that brings us to, okay, before prescribing a certain antibiotic, and again, when you use the term antibiotic, those are the drugs that are going to kill bacteria or inhibit bacteria. The physician really needs to look at the complete history of the patient. Otherwise, I mean, they can really be putting their patient in danger. So number one is they need to know whether they have other pre-existing conditions, right? That can basically affect the activity of that drug. And how that drug is going to be like absorbed, or how that patient is going to respond to that drug. They need to know whether that patient has certain allergies, and especially if they have certain allergies to that drug, they're about to go ahead and prescribe them, because some of these allergies could be severe. You know, some allergies could be, okay, this individual would start having like a rash, hives, which is definitely like, you know, uncomfortable. But then some of these allergies could be fatal. The person could have an anaphylactic shock and they can't breathe. And so again, some of these allergies could definitely be fatal. So you don't want to be prescribing a drug to your patient if they are allergic to it. And sometimes they would be allergic to a drug that is similar to the one, or that's under the same class as the drug that you are giving them. So again, you want to kind of avoid this whole entire, you know, class of drugs. You don't want to give them any of them, right? And go to another class of drugs. And then you need to know, like, you know, whether their liver and kidneys are functioning properly, or, you know, do they have, you know, kidney or liver disease, because these are organs that are going to help you excrete, right, that drug out of your body. So you don't want to be giving them something that's, you know, pretty strong, you know, especially if they cannot excrete it very well. Again, you're going to then intoxicate them instead of helping them out. And then, of course, you know, age, you know, so whether you're prescribing it to an infant, or, you know, to an elderly individual, or to a young individual. Again, usually elderly and infants, you know, they have a pretty hard time, you know, excreting those drugs out of their system. So again, you have to think of the dosage, how much you're going to give them. Of course, you know, pregnant women is another, you know, big thing to consider. And then, of course, you want to ask them whether they are taking other drugs. And so you, like, you know, the doctor has to ask, like, you know, these questions, because sometimes, like, the patient, you know, doesn't see, like, okay, why is it bad for me to be, you know, taking, like, you know, drug A along with drug B, you know, how is that going to be a problem? Well, some of these drugs can actually contradict each other. And so if they are taking a drug and you go ahead and prescribe them, let's say antibiotic A, that drug that they are already taking is not going to allow that antibiotic to actually function properly. So it's kind of pointless then. So then, you know, so that's another thing. And then sometimes actually the combination of certain drugs could actually lead to toxicity. So that's another thing, you know, other than the drug might not function properly, you know, combining two certain drugs together can actually, you know, as I said, lead to intoxication. So these are all very important things, you know, that the physician has to ask, you know, their patient and think about before prescribing an antibiotic. And then, of course, you know, some other things also to consider before prescribing a certain antibiotic is you want to know the identity of that microorganism, because not all antibiotics, as I said, remember how we said there are narrow spectrum antibiotics, so they only work, let's say, against gram-positive or gram-negative. So let's say you prescribe an antibiotic to your patient, and this antibiotic only targets gram-positive. But guess what? Your patient has a gram-negative bacteria. Then this antibiotic that you just prescribed them is going to be useless, right? It's not going to work. On top of that, it can actually lead to antimicrobial resistance. And we're going to talk about how is that going to develop. And so therefore, the identity of the microorganism is super important before you go ahead and prescribe a certain antibiotic. And that can be done, by taking a sample from your patient. So, whether you take a blood sample, a sputum sample, a stool sample, these are some options, right, of where you can, some samples that you can collect, and therefore, do a gram stain, for example, and figure out whether, this individual has a gram positive or a gram negative, and plus you're going to know whether they even have a bacterial infection. It might not be even a bacteria infection, so there is no even point of prescribing them an antibiotic. But it's super important that you really know the identity of that microorganism that you are dealing with. Again, to help you, prescribe the correct antibiotic if it is bacterial infection in the first place. And then, as I said, you have to kind of know the overall medical condition of your patient, right? If they're taking any other drugs, if they're immunocompromised, if they are, if they have like liver or kidney failure. Again, their age, all of that has to factor. Other things like, let's say whether they drink also lots of alcohol, so if you have an alcoholic patient, again, you have to kind of put that in perspective because there are certain drugs that are actually going to be very toxic if you take them along with alcohol. Okay, so again, these are all things that you have to think about, and you have to kind of tell your patient also, kind of like be aware when you're taking this drug, you shouldn't be taking it with something else. You shouldn't be, having alcoholic drinks along with it. So again, these are super important things to watch out for. And then you want to know, of course, after you identify the microorganism, by the way, you want to know whether that antibiotic that you're, let's say, about to prescribe, you want to know that this antibiotic is effective against that bacteria. So for you to figure out whether this antibiotic is effective against that bacteria, you have to do certain tests in the lab to figure out, again, how susceptible is your microorganism, to that antibiotic that you're about to prescribe. Okay. Again, you want to prescribe the best antibiotic that will go ahead and be very effective against, that specific bacterial infection that your patient has. And there are other factors that kind of, you will have to watch out for in terms of the dosage, right? How much of that, what's the dosage that I should be giving my patient? Because you might have a very good, effective antibiotic out there, right? But in terms of the effective dosage of it is so high that it's going to intoxicate your patient. And so therefore, guess what? You can't give it to them, okay? You will have to think of another, another drug, another antibiotic that will, still work, but at the same time, it's not going to intoxicate your patient. So you want to think of, how susceptible is your microorganism? And you want to also think of the dosage, okay? How much do you give them? So in the next few slides, we're going to talk about certain tests that you can do to figure out the susceptibility of your microorganism. Okay, so let's take a look at this technique right here. It's known as the Kirby-Bauer technique or the Kirby-Bauer test. And there's also another name. You can say the disc diffusion test. So if you ever see disc diffusion test or Kirby-Bauer test, it's the same thing. So what is the Kirby-Bauer test, and what is it used for in the first place? So this test is actually going to determine basically the sensitivity of your microbe against that drug that you are about to use. Okay, so you want to know the resistance level or the sensitivity level of your microbe against, let's say, a certain antibiotic. Okay, let's just concentrate on bacteria and antibiotics. Okay, guys, so we want to know, let's say, whether that bacteria how sensitive it is to that antibiotic that I'm about to use, or is it going to resist it, and therefore that antibiotic is not going to be able to, again, inhibit it. So the Kirby Bauer test is usually better off, okay, as a test if you want to test aerobic bacteria or facultative anaerobic. It just works better, okay, with these type of bacteria versus obligate anaerobes. Okay, so this test is preferred to test aerobic or like obligate aerobes or facultative anaerobes bacteria to that certain chemical, to that certain drug, let's say an antibiotic, and you want to go ahead and figure out if your microorganism is sensitive or resistant to it or not, because that's going to help then the clinician determine, right, whether that's the best, antibiotic to prescribe to your patient or not. Okay, so it's going to, again, help the clinician figure out, okay, what is the treatment, right? What's the treatment course that we should be, following? And so how do we figure that out? I'm going to show you right here, but basically you look for a zone of inhibition. So, and based on the zone of inhibition and based on the size of the zone of inhibition that you get, you will be able to tell whether your bacteria is sensitive, resistant, or there's a third term that we use, intermediate to that drug. So let's first kind of explain how it's done, and then I'll explain how you measure that zone of inhibition. So you start off with a plate, right? An agar plate. But by the way, this agar plate right here is the media. We refer to it as the Mueller-Hinton agar, and I have the name on the on the upcoming slide. So it's called the Mueller-Hinton media, and it has a lot of proteins within it, and it's best used. That agar, Mueller-Hinton agar, is best used when you want to go ahead and do an antibiotic test. Okay. So you have your Mueller-Hinton agar right here. What you go ahead and do before you dispense the antibiotic, of course, you have to go ahead and inoculate your plate. So right here, it says it's already inoculated. So you would have to, inoculate your plate, spread that bacteria, all over your plate. And what we usually do is we actually spread the bacteria several times. Okay, so you would spread it once and then rotate your plate, spread it a second time, rotate it one more time, spread it a third time, just to make sure that your whole entire plate is covered, okay, with that bacteria. And then you can actually get one of these cool, antibiotic disc dispensers. Instead of you putting the antibiotic discs one at a time, you can get this cool disc dispenser, and you go ahead and all at once, put down the antibiotic discs on your plate. And notice how these discs, so again, these discs kind of look like little papers, you guys, okay? And they're basically impregnated with the antibiotic. So this little piece of kind of disc that you're seeing is has the antibiotic, okay? So, and we usually, put several different antibiotics. So I could put penicillin here, amoxicillin, tetracycline, gentamicin. So you can put several different antibiotics all at once, okay? And leave the same distance. So of course with the dispenser, what's great about using the dispenser is it's already going to place it for you equidistant, from each other. Versus when you place it with a tweezer, I mean, you will have to kind of, make sure that, again, you're leaving exactly the same, space between these discs. And so you go ahead and place the discs. Now, one might ask, well, how am I going to know whether this is the penicillin disc, this is the amoxicillin? The discs come with letters on them, okay? And so usually make sure that those letters are facing up. So, P is going to have P, it's going to have A, M, O, again, acronyms, for the antibiotic, and it's also going to have a number. It's going to tell you the the dosage, okay, of that antibiotic that you just placed, or not the dosage, I should say, the concentration, okay? So it's going to tell you like the concentration of that antibiotic that you just put on the plate. And then make sure just to kind of like, gently touch. So after you place the antibiotics, just kind of, with a forceps, go ahead and just kind of gently touch it, just to make sure that you have this contact, right, with the bacteria that's on the plate. You got to make sure that, this disc is touching the agar. It's touching, like, the bacteria that you just deposited there. And then after you do that, you go ahead and you put the lid, of course, and go ahead and incubate it. And you're going to go ahead, put it in the incubator. After you go ahead and incubate it, you go ahead and take it out, and you start measuring the zone of inhibition. So this is what you're going to see. So first of all, right here, you're going to see the bacteria growth, and it's going to be a confluent growth, meaning like a lawn of bacteria. So you're not going to see colonies, okay, because the way you spread it, okay, is not going to lead to colony growth. It's going to lead to like a lawn of growth. And so we call that a confluent, growth of bacteria. And it's going to be all over your plate. And this is what you want to, go ahead and take a look at. So you want to take a look at the discs, right, that have the, the antibiotics, and look at whether you have any zone of inhibition. Basically, any zone of no bacteria growth around it. The larger the zone, okay, the larger the zone, the better. That would tell you, like, for example, if we're comparing this orange antibiotic compared to this green one, notice how there is a larger zone, okay? So that would tell you that this antibiotic seems more effective. Now, why am I saying seems more effective? Because we can't really be 100% sure, because you have to measure the zone of inhibition and really figure out whether that zone of inhibition is really, good or not. Okay, so don't just go ahead and see like, oh yeah, this has a larger zone of inhibition compared to that one. This is the antibiotic that I should be prescribing to my patient. Absolutely not. You have to measure that zone of inhibition, and after measuring it, again, we'll talk about what are the other steps. But if you see absolutely no zone of inhibition, well, that means what? If you see absolutely no zone of inhibition, kind of like this one, see how there is nothing around this antibiotic disc? Well, this tells you that this antibiotic is not effective at all against that bacteria. So definitely, you don't want to be prescribing your patient this one, because it's not going to do anything if you prescribe your patient this antibiotic right here. And it would tell you that in this case, your bacteria is definitely resistant to this antibiotic right there. Okay, so this is like the easiest one for you to figure out the result right away, that you can tell that your bacteria is definitely resistant to this one. This one could also be resistant, by the way. The bacteria could also be resistant to this green antibiotic. You might say, well, how is it resistant? I do see a bit of a zone of inhibition. Well, that's why I'm saying you have to measure the zone of inhibition, because depending on the measurement, you can tell whether your bacteria is resistant or susceptible or intermediate. So seeing a zone of inhibition doesn't mean that your bacteria is not resistant. It could still be resistant, okay, to it. But of course, seeing absolutely zero zone of inhibition, yeah, that's an automatic resistance, okay? And we usually measure it in terms of millimeters, okay? So the zone of inhibition, we measure it in terms of millimeters. And here's, by the way, the name of the medium, the Mueller-Hinton medium. So as I said, this is the medium we usually use with the Kirby Bauer test. It's pretty high in protein, and it's just better, right, to use when we are doing this antibiotic test. The antibiotic has an easier time actually getting dispensed and spreading on a Mueller-Hinton agar medium. And one more thing before I move on, when you go ahead and place those antibiotic discs, what happens is the antibiotic starts to basically spread. Okay, so it kind of starts to spread like this throughout your, throughout the plate. And if you do get a zone of inhibition, kind of like this one right here, you have to go ahead and measure it. Now, by the way, when your antibiotic is spreading out on your plate, the more your antibiotic spreads out, the less the concentration of that antibiotic. So meaning the following, if I use like a different color, so like right here on the edge, okay, of that zone of inhibition, I'm going to have like the lowest concentration of antibiotic versus like, or maybe I should go with an X, hold on. So right here, okay, I'm just grab my pen. So right here, okay guys, if I put like an X right here versus if I put like an X more like on the outside, definitely that inner X, the antibiotic concentration is much higher compared to, compared to this X right here out on the edge. So as the antibiotic diffuses, okay, the concentration decreases, okay, the more the antibiotic diffuses out. So of course, closer to the disc itself, that's where you're going to have the highest concentration. And then as the antibiotic diffuses away from the disc, the concentration of the antibiotic starts to decrease, okay? And so this is an image right here. So one more time, you guys see the confluent growth, right? This is what I was talking about. You're not going to see colonies. You're going to see something that looks like this, like a lawn of bacteria. And here are the antibiotic discs. Remember how I said you're going to see letters and numbers? So the letters are basically an acronym for, for the antibiotic that you are using. So VA could be vancomycin, so E could be erythromycin. So again, we usually have like a key, right? That would tell you, okay, E is this, triple S is this type of antibiotic, double N is this antibiotic. And then what are the numbers? What does 2, 75, 10 means? This is the concentration. Okay, this is the concentration of the antibiotic. So this disc right here, that's the concentration of this antibiotic within that disc, okay? And so you go ahead, either place those discs with a tweezer, right? Or use that dispenser, as I said. And then just make sure that, again, it's touching the plate, and then stick it in the incubator. And then after you take it out of the incubator, this is what you want to start measuring, the zone of inhibition. So let's say that I'm looking at this antibiotic disc and I absolutely see a 0 zone of inhibition, nothing. What does that mean? It means that this antibiotic is not effective. It cannot inhibit the bacteria growth. And so therefore, this would be the one not to prescribe to my patient because it will not help them at all. And that means that the bacteria, right, the bacteria growing around this antibiotic right here is resistant to this antibiotic, okay? Now, kind of same here. I don't see any zone of inhibition, so again, my bacteria would be resistant to this antibiotic as well. Now, let's take a look at, these 3 antibiotic discs right there. Notice how there is a zone of inhibition around each one of them. Okay, so that means these antibiotics were able to inhibit the growth, right? They were able to inhibit the growth of the bacteria around them. Now, but the thing is, just by looking at the zones of inhibition, can you tell, okay, whether your bacteria is resistant, intermediate, or susceptible to that antibiotic? No, you cannot tell. You have to measure, okay, so you would get your ruler, and you will have to measure the whole entire diameter, okay, so from one end, okay, to the other end of your zone. So you measure this whole entire diameter, again, in terms of millimeters. Okay, and then you have to take that number, take a look at a certain chart that we have, and figure out whether that zone of inhibition makes your bacteria susceptible, intermediate, or resistant. Okay, and I'll show you that chart in just a minute. Okay, so let's say you have your Mueller-Hinton agar plate. You went ahead and inoculated the bacteria on that plate, and then you went ahead and you placed the impregnated discs that are impregnated with antibiotics, right? So these are the antibiotic discs, and then you incubated your plate. You took it out, and now we are about to interpret the results. So one more time, these discs are going to have letters on them, and those letters are basically referring to the antibiotic that you are using. So for example, GN is the gentamicin antibiotic, AMP is the ampicillin antibiotic, and then the numbers are referring to the concentration, right? How much of that antibiotic is, impregnated within that disc. So 10 grams of gentamicin, 5 grams, 30 grams. So these are what those numbers mean. Now, we see a zone of inhibition, right? Notice how you see a zone of inhibition around each of these antibiotic discs, okay? What you want to do with these zones of inhibition is go ahead and grab a ruler and measure the whole entire diameter of that zone of inhibition. Why do we want to do that? Because we want to figure out the following. We want to figure out whether my bacteria is resistant to that antibiotic, meaning that the antibiotic is not effective against it, or I want to know whether my bacteria is susceptible to the antibiotic, meaning the antibiotic is very effective against it, or I want to know whether my bacteria is intermediate to that antibiotic, meaning the antibiotic is effective but not, not highly effective. So of course, if you have such a plate, and I'm going to tell you again how to figure it out, but let's say this is susceptible, resistant, or intermediate, okay? And now you want to make your decision. Should I give my patient gentamicin? Should I give them, tetracycline, or should I give them enrofloxacin? So definitely you want to give them this one. You want to give them enrofloxacin because it is, your bacteria is susceptible to it. Versus this one, your bacteria is resistant. So you don't want to give your patient an antibiotic that the bacteria infection that you have is resistant to it. It's not gonna, it's not gonna help them out. Intermediate, I mean, yes, the antibiotic is effective, but not as highly effective, right? And so therefore, I mean, you're better off with the, with that one. But there are other things also to watch out for. After you figure out, okay, this is the best antibiotic that I should be using, you want to figure out, okay, how much of that antibiotic I should be giving my patient. You want to figure out the dosage. And we're going to figure out how you can tell, and how you can determine the dosage, that you can give to your patient. But if the dosage that, let's say, of this antibiotic that you're about to give your patient is actually too high, and your patient is not going to be able to handle it, then guess what? You're not going to be able to prescribe them that. So that's another thing you need to, think about is, okay, this antibiotic is, is great to use because the bacteria is susceptible to it. But before I go ahead and make that final decision, okay, I'm going to give my patient this antibiotic, I have to think of, okay, how much of that antibiotic can I go ahead and give my patient? If the dosage is extremely high, then you're going to be basically intoxicating your patient. And so you can't give them that antibiotic, and you have to think of another one. Okay, so maybe then you move on to this one. Even though, yes, this is intermediate, but if the dosage is going to be okay and your patient is not going to be intoxicated, then, okay, give them this antibiotic right here. Even though, as I said, it's not as great as this one, but in terms of, is it going to poison my patient or not? That's another factor, right? You have to think about. So, before we talk about how to figure out the dosage and everything, let's just concentrate on how to read the zone of inhibition. So you grab a ruler, okay? This ruler right here, it's in centimeters, but you have to convert your number to millimeters. Remember, the zone of inhibition must be measured in terms of millimeters, okay, not centimeters. Okay, so I have a ruler and it's in centimeters, no problem, okay? How can we convert from centimeters to millimeters? Multiply by 10, right? So 1 centimeter is 10 millimeters. So let's go ahead and figure this out together. So here is the 2.5 mark, right, you guys? Right here, this is the 2.5. Notice how your zone of inhibition is kind of like right here. So that's about what? That's about like 2.7 centimeters. Or maybe I should write it like right here. So my zone of inhibition is about 2.7 centimeters, okay? How much is that in terms of millimeter? Multiply by 10. So that's 27 millimeters. Okay. What does that mean? Okay, what is 27 millimeters? Is that, again, does that make my bacteria susceptible, intermediate, or resistant, right? You have to be given a chart. Okay, you have to be given a chart, and the chart is going to tell you something like this. But it could actually be more specific and tell you also the intermediate level, which is not giving it to you right here, but it's okay. I'll show you another chart, but it's going to tell you something like this. For this antibiotic, if your zone of inhibition is anything less than 17, then your bacteria is what to this antibiotic? It's resistant, okay? If you get a zone greater than 22 millimeters, this means that your bacteria is susceptible to that antibiotic. Okay, so what did you get? You got 27. So if you get 27, which is greater than 22, that means that your bacteria is susceptible. Okay, let's say you measure the zone of inhibition. Okay, so again, you put your ruler, you measure the whole entire diameter, and let's say that, this is about 11 or so, or let's say 10, okay, millimeters. Then you go to the chart and you see, okay, anything less than 17 makes my bacteria what? Resistant. So the bacteria right here is resistant to this antibiotic right there. Okay, let's say you measure this one, right here, and actually you go, by the way, measure it from the widest part. Okay, so like right here, the widest. So you measure it, okay, and again, I don't really have the ruler, so we're just gonna assume, okay, let's say 24. Okay, let's say this is about 24. Okay, then if it's 24, take a look at the chart. Anything larger than 23, that means that my bacteria is susceptible. Okay, so let's say that you have those two susceptible ones right here. That means that you want to make your decision, right? I mean, because let's say you have these two susceptibles, you have those two that are resistant. So resistant, you don't want to be giving your patient any antibiotic that your bacteria is resistant to. Okay, so those two antibiotics right here are definitely out of, out of the debate. Okay. Okay, now I have two that are intermediate and two that are susceptible. Which is better? Of course, it's better to, think of the susceptible ones. So you want to go ahead and kind of, let's say, like make your decision between this one and, and that one. Let's say you didn't have two susceptible, then okay, think of the intermediate as well. But before I go ahead and figure out, okay, should I be giving my patient, let's say, cefotaxime or enrofloxacin? Okay, enrofloxacin. I have to think about the dosage. Okay, you want to know, which out of those two, right, dosage-wise, is going to be, non-intoxicating to my patient. Okay, so again, before you make your decision about which antibiotic to give your patient, there's another test that you have to do, okay, to figure out the dosage, because you don't want to be giving your patient an antibiotic that they will have to take such a high dosage of, okay, otherwise you're going to be intoxicating them. So, Okay, and this is just to kind of show you, okay, how the chart is going to look like. So the chart is going to, look something like this. You have a bunch of the different antibiotics listed out for you, okay, erythromycin, gentamicin, neomycin, etc. And you have the numbers, right? What's considered susceptible, okay, resistant, and there's usually also like a third chart, like intermediate. But intermediate, I mean, it's going to be, sometimes they don't list it out because intermediate is going to be something in between the resistance and the susceptibility. And so let's say that this chart right here, I mean, you're looking at Staphylococcus aureus, okay? And I want to know, which antibiotic should I prescribe my patient if they have a Staphylococcus aureus, infection. So see how with this antibiotic right here, let's say the zone of inhibition was 15, okay, which means that this antibiotic, is pretty good, okay. The bacteria, Staphylococcus aureus, is definitely susceptible to this antibiotic right here. And notice if you use erythromycin, Staphylococcus is kind of, showing a bit of resistance, but I mean, not too much resistance. So therefore, it's like intermediate, okay? It's not greater than 18, so it's not susceptible. It's not less than 13, so it's kind of something in between. So in between, we call that intermediate, okay? Notice how Staphylococcus aureus is definitely resistant to neomycin because you got like 12, and it's right there, so less than 12 or kind of like 12, that is resistant, okay. 10, okay, with penicillin G, that's resistant. So, I mean, if someone has a Staphylococcus aureus infection, you definitely don't want your physician to be prescribing you neomycin or, penicillin G, okay, because then you will still have that infection, okay? So you don't want to be prescribing your patient antibiotics that your bacteria is resistant to. So notice how there are multiple, antibiotics that Staphylococcus aureus is sensitive to. Now, the decision then comes, okay, should I be giving my patient vancomycin, tetracycline, or any of those other antibiotics right here? Then you need to think about, first of all, is your patient allergic? If vancomycin, again, like, the bacteria is sensitive to it. But let's say your patient is allergic to vancomycin, then of course it's out of the, it's out of the debate. Then I can't give my patient vancomycin if they are, allergic to it. Okay, so then maybe think of, another, like, antibiotic and see, okay, again, like, ask your patient, like, are you allergic to it or not? So one thing is think of the allergies, right? Think of the other drugs they're taking. What if they're taking other drugs that's going to contradict with this antibiotic? Then again, you don't want to be prescribing them this antibiotic right here. If they're taking other drugs that's going to, contradict with it. Another thing to think about is, okay, how much can I give them? Okay, if the dosage that I will need to give them so that the bacteria will be, susceptible, okay, to it is too high to the point that it's really going to intoxicate my patient, then again, it will be out of the question. So therefore, I'm going to show you then the test that you will do to figure out what is the minimum dosage that you can give your patient. Because with antibiotics, we always try to give the minimum dosage. You don't want to be giving high dosage of antibiotics because, again, these drugs can really then affect you, the host, in a negative way. Okay, we're going to talk about a test called the tube dilution test. What this test is used for, it's going to help us determine something called the MIC, the minimum inhibitory concentration, meaning what is the minimum concentration of a drug I can give my patient, and it's still like a pretty low amount of that drug that I'm giving my patient, but at the same time, the bacteria is still going to be susceptible to that minimum concentration of that drug. Okay. The thing is, we always try to give a minimum concentration of a drug. Okay, when we're prescribing, when a physician is going to prescribe drugs to their patient, they want to think of, okay, what is the minimum concentration that I can give them, but it's still going to be effective. Okay, why do we try to always go for the minimum concentration of a certain drug to take? Because these drugs, they're strong and they can definitely cause negative side effects to the host. Okay, and so the less you give them, the better. Okay, and that's true for any drug out there. Okay, the less concentration you give, the better. Okay. Okay, so how do I know how much to give them? How do I know, okay, what is the minimum concentration that I can give them? And the bacteria, let's say, is still going to be susceptible to that concentration. You can do something called the tube dilution test. You can do this test, by the way, with any antimicrobial that you are testing. It doesn't only have to be antibiotics. If you are, let's say your patient has a fungal infection, and you are using an antimicrobial against fungi. And again, you want to figure out how much of that, fungus treatment I should be giving them. Then again, you could do the tube dilution test. So again, you want to know what is the smallest effective dosage that you can give your patient. So how do we do that? Well, it's called the tube dilution test. So we're going to have a bunch of test tubes. In that first test tube, which is going to be your control, you're going to have your broth and you're going to inoculate it with the sample, right? And like, let's say, for example, you're going to inoculate it with the bacteria, sample, and you're not going to put any antimicrobial drugs. Again, let's say, since we're talking about bacteria, we're thinking of antibiotics. I'm not going to put any antibiotics in this, okay? And I'm going to go ahead and incubate it. And of course, after the incubation, you're going to see turbidity. So, which means you do have what? Bacteria growing in there. Okay. Then you grab a bunch of test tubes. In each test tube, you're going to put the same amount of the broth, same broth, of course. And then you're going to inoculate it with the bacteria. Make sure that when you inoculate those test tubes with the bacteria, you're putting the same amount of bacteria in each test tube. You don't want to, put too much bacteria in here and then not put a lot of bacteria in there. So then that will affect your data. So make sure to put the same amount of bacteria in all of your test tubes. And then you're going to put the same antibiotic also in all test tubes. But what you're going to, do different is how much of that antibiotic you're placing is going to differ. So in this first test tube, I'm going to put 0.2 micrograms per milliliter of my antibiotic. In this one, I'm putting 0.4, 0.8. This one is going to get the highest, 12.8 micrograms per milliliter. Okay, so put your broth, inoculate your test tubes, place your antibiotic, different concentrations of your antibiotic, and then go ahead and incubate your test tubes. Then go ahead, pull them out and take a look at it. Notice how here the bacteria is growing. Okay, so that means this dosage, should I be giving my patient 0.2 micrograms per milliliter of that antibiotic? No, because do you see how it wasn't that effective and the bacteria is still growing? So you don't want to be giving your patient that amount. Okay, what about 0.4? You still have growth. I don't want to be giving my patient 0.4. Okay, what about 0.8? Still I have growth. 1.6, I still see growth. 3.2, I still see growth. So that means you don't want to be giving your patient, any of these dosages, because then they're still going to have the bacteria persisting in their, in their body. So what is the minimum amount that I can give my patient? 6.4. Okay, that is the minimum amount that I can give them. I can't give them anything less, right? Can I give them 3.2, 1.6? Absolutely not, because they have growth. So the minimum, dosage that I can give my patient is, or the minimum concentration that I can give my patient is 6.4 micrograms per milliliter. Okay, now you can give them 12.8, right? See how 12.8 also is no growth? But I mean, why give them 12.8 if 6.4 works? You always want to go as I said, with the minimum concentration, because that's going to be better, right, for your body, okay? Because any drug out there is going to have, especially if you take it a lot, etc., it can affect your body in some way or the other. And so therefore, we always go with the minimum dosage that I can give them. So in this case, 6.4 micrograms per milliliter. This is just another, image to kind of show you, okay, see how these two are turbid, which means that when you added 2 micrograms per milliliter, bacteria was still growing. 4 milligrams, it was still growing. Here you have 8, 16, and 32. Which dosage should you be giving your patient? Should I be giving them 32? Well, I mean, with 32, there is no growth. But I mean, why? Why give your patient such a high dosage when you can give them what? When you can give them 8 and it's still effective. So 8 will be the minimum inhibitory concentration that you should give your patient. Nothing less than 8, because see, if you go less than 8, the bacteria is still growing. So that means the minimum dosage that I can give my patient, or what is the MIC. So if I give you a picture like this and I ask you what is the MIC, the MIC is 8 micrograms per milliliter. Okay. There is another way to figure out the MIC, and we call this test the MIC assay. And instead of putting it in test tubes, we have this plate, and it has like multiple wells. And you can go ahead and in these wells, what you do is you put some of your broth and some of the sample. And then in each well, you put, a different concentration of the antibiotic that you are questioning. So here you would put the lowest amount, and then you would keep increasing the concentration until like right here would have the highest amount. Okay, and let's say in this well right here you have 32 micrograms per milliliter. What you do is you go ahead, incubate it, and then take a look at your results. First of all, if there is no kind of like orange, okay, in the middle, this means like, okay, nothing is growing. Okay, so this is what we're gonna, first of all, let's gonna understand, right, what we're seeing. So if you don't see any orange right in the middle, that would mean nothing is growing. If you do see like orange, that means, there is growth. Now with this plate, what's good is that you can actually put several different antibiotics in each row. So this row, I could put clindamycin. In this row, I could put penicillin. In another row, I could put erythromycin. So see, what's great about this assay test is you can test several antibiotics all at the same time, because each row is getting a different antibiotic. Okay. Again, with penicillin, you're adding here the lowest concentration of penicillin, and then you're adding the highest concentration of penicillin right here. The same thing with erythromycin, lowest, and then here would be the highest. And what you want to see is, what is my MIC? What is the minimum concentration that I can give my patient and it's still going to be effective? So let's take a look at clindamycin. Notice how with clindamycin, you have growth throughout the whole entire row, and this is the lowest, okay? And here's the highest. Do you see how the highest right here, again, you know exactly what's in each, well. So let's say, for example, well, let's say, again, I'm making this up because I don't have the actual, numbers, but let's say this is 0.02 micrograms per mil. And then here I have, 32, in this well, I have 32 micrograms per mil. Okay. Notice how if I give my patient clindamycin, or if I'm thinking of giving my patient clindamycin, I would have to give my patient something larger than 32. Why? Because with 32 micrograms, do you still have growth? Yeah, do you see this kind of like orange right here? That means growth, okay? So I would have to give my patient more than 32 micrograms per mil. That's not a very that's not then a very good thing, okay? Now, it could be, again, depending on the bacteria sample that you have. With this bacteria sample, clindamycin is not really the best to give your patient, okay? Does that mean clindamycin is going to act like this with any bacteria sample? No, it depends on the bacteria sample, okay? Not all antibiotics are effective, okay? Similarly, okay? And so therefore, for the MIC for this antibiotic, the MIC is greater than 32. Okay, let's say with penicillin, okay? Notice right here, I don't see any growth with this one right there. I don't see any growth. That means that, notice how here I do see growth. I see growth right here. I see growth right there. So again, you don't want to be giving then your patient these, okay? You don't want to be giving them these concentrations, because then the bacteria is still going to be growing, okay? You want to give them, something that the bacteria is not going to, it's not going to grow anymore. And so here the MIC is 0.06. Okay, let's take a look at erythromycin. Again, look for the well that doesn't have any growth. Okay, notice right here. Okay, this is the first well. Look for the first well that doesn't have any growth. You don't want to be going to this well right here. I mean, why would you, right? Because this is going to be a higher concentration, the one that I have like an X. Why would you go with this one when you can go with this one right here? And this one would be the MIC 8 micrograms per milliliter. So let's say you want to make a decision. Should I be giving my patient clindamycin, penicillin, or erythromycin? Notice how clindamycin is like out of the question, out of the debate, because you would have to give your patient what? Something higher than 32. That's a lot, okay? So, okay, no, I'm not going to give my patient that one. So now the debate is between penicillin and penicillin and erythromycin. Which one should you give your patient? If the patient doesn't have allergies to either, okay, my patient doesn't have allergies to either penicillin or erythromycin, and my patient is not taking other drugs that would contradict with either. Okay, so let's say after you kind of checked off all of the other boxes, you're debating whether to give them penicillin or erythromycin. You're better off giving them what? Penicillin. Why? Because then you would give them something, less in terms of the concentration, 0.06, and it is already effective. Versus with erythromycin, I would have to prescribe my patient 8 micrograms per milliliter. So then erythromycin would be out of the debate, and so you will give your patient penicillin. But of course, after you've checked off your other boxes, like your patient is not allergic, etc. Okay, you would want to give them then penicillin. So make sure you know how to read this assay right there, and make sure that you kind of also know how to read then the MIC, and how you can then determine, okay, which antibiotic should you be giving your patient. Of course, you want to prescribe them the antibiotic with the lowest MIC, okay? And this is just another, image for you to kind of see. So right here, again, you can see that they are, each row gets a different antibiotic. And pink in here means growth, blue means no growth. So see how if I give them this antibiotic, the MIC right here, I would have to give them nothing less than 0.125. Okay, if I give them this antibiotic, okay, and the MIC is right here again, 0.125, so same, okay. But let's say I go with this antibiotic right here, I would have to give my patient what? I would have to give my patient 256 microgram. That is, okay, that's out, okay, because that's too much, okay. Because notice how you have something that's, I could be giving my patient this antibiotic and I would only have to give them 0.06. So why would I go with 256 when I can give them, another antibiotic, and I can give them 0.06 micrograms per milliliter. So again, this, out of this whole entire chart, okay, out of this whole entire chart, which antibiotic seems to be the best? Well, this one right here. Okay, why? Because the MIC is the lowest. I can give my patient 0.06 and it's already going to be pretty effective, okay, and no bacteria growth. So always go with the one that has the lowest MIC. So let's say my patient is allergic to this one though. Okay, if my patient is allergic to it, unfortunately, okay, of course I can't give it to them. So then go with something else. What's the next one that you should go with? Well, I mean, then debate, with these three right here, because they're all 0. What? 0.125. And again, see then if your patient is, again, one more time, allergic or taking, drugs that are contradicting. And then from there, of course, make your decision. But if your patient is not allergic to anything and all of that other boxes, like, check, then of course you would want to give them this one right here because it's the lowest MIC. Now there's another test called the E-test, and it's another test to help you figure out the MIC. So again, you want to figure out what is the minimum dosage that I can give my patient, and the bacteria is still going to be susceptible. And the E-test can be done, to test susceptibility of both gram-negative or, gram-positive bacteria. So you get a plate, you go ahead, inoculate your plate with the bacteria, and then you go ahead and place these strips onto your bacteria, onto your plate. And it's super important how you place those strips. So these strips have antibiotics, but instead of the discs, right, instead of the Kirby Bauer method, we're basically using these strips right there. So they're antibiotic strips, but what's unique about them, is they have varying amount of the antibiotic. So up here, you have the highest amount of the antibiotic that's going to diffuse out. So for example, you see how there are numbers. So this one has 256, then 192, 128, 96, 64, and then all the way down you see 0.016. So meaning that up here, you have the highest amount of antibiotic that can diffuse onto your plate. And then here, you have the lowest amount of antibiotic that can diffuse into the media. So those E strips, they're antibiotic strips, and they have gradient amount of that antibiotic. Now, it's super important how you place that strip. So, of course, you would have to handle it with a tweezer, and you would take that strip, place it onto the bacteria, place it onto the plate, and you have to let the numbers face up because the antibiotic is actually on the bottom side of that strip. So you have to let the antibiotic touch the bacteria. What happens if you go ahead and put the strip upside down, then it's not going to work. The test is not going to work because the antibiotic is not diffusing into the media. Okay, so one more time, the antibiotic is on the other side of that strip. So therefore, you want to let the numbers face upwards because on the bottom side of that strip is where you have the antibiotics. Okay. So you go ahead and place it. So again, make sure you place it correctly though. And you go ahead and kind of, place it like this. If you can place more than one strip, by the way, and each one could be a different antibiotic. So this one could be penicillin. This one could be gentamicin, amoxicillin. And what we're trying to do is figure out one more time the MIC. So you have so many different tests to figure out the MIC. You could do the tube dilution test. You could do the MIC assay, or you could do the E-test, okay? So what you're going to see is something like this. If your bacteria, again, that the antibiotic, is effective against your bacteria, you're going to see a zone of, inhibition. And again, the point of this test is I want to figure out what is the lowest dosage that I can give my patient, okay, and it will still be effective. So you read the MIC basically at the edge of that inhibition eclipse or ellipse that you get. And so you're going to get like a balloon shaped like this for a zone of inhibition. And the reason why you're getting like a balloon shaped is because Here you had the highest amount of antibiotic being diffused. As the amount of antibiotic gets reduced, of course, the zone of inhibition is not going to be as great. So that's why you get this kind of, hot air balloon shape to it. And you read the MIC at the lowest, like at the edge of where, you see that inhibition zone. So for example, in this case, I would want to give my patient from that drug, from amoxicillin, 0.125 micrograms per milliliter. I don't want to give them anything less, because anything, less right here, I don't want to give them, for example, 0.04. Okay, because if I give them 0.04, do you guys see how there is still growth? Okay, so it won't be effective. So I don't want to give them anything less than 0.125. Now, why shouldn't I give them something higher? I mean, why would I, right? Why would I give them 64 micrograms when I can give them 0.125 and it's still as effective, right? As I said, always give your patient the lowest amount possible, right? The lowest concentration possible, because you don't want to intoxicate your patient. For example, here, notice how the MIC for this one, for this antibiotic, it's 0.75. So you don't want to give your patient anything less than 0.75, and definitely, why give them something higher? Okay, so the MIC for this one would be 0.75 micrograms per milliliter. Make sure to know how to read it, okay, guys? So one more time, this is just a more zoomed in image for you. So again, these letters indicate what type of antibiotic you're using. You have the gradient. So up here, 32 micrograms is going to be diffused onto your, into your medium. Here, 24. Then you have right here 2. So as you guys see, there is a gradient. And the more, the lower we get, the lower amount of antibiotic is being diffused. So, okay, do you want to give your patient 0.19 micrograms of this antibiotic? No, because see how there's still growth? I want to give them 0.25. See how right here, right at the edge. So I can give them 0.25 and it's going to be, effective. Nothing less than 0.25. And I mean, even though you can give them, you can give them 1.5, you can give them 3, but I mean, why give your patient, such higher, dosage? Always go with the lowest one, so 0.25. So see how for each antibiotic, the MIC is definitely going to be, different. So, and so again, this is the E-test. You always go with the right here with the edge of the zone of inhibition and read it, and that would be the number. So right here it would be around like 0.125 for that one. Right here it would be 0.25 for this one.